Afternoon. Thanks for joining us. I hope that it is a little less smoky where you are than where we are, but the smoke makes us very, very clear that we have several challenges that we're facing all at the same time. I'd like to give you a little bit of background about the Mendocino Coast Children's Fund. We are the oldest grassroots child advocacy program in Mendocino County. And because children live in families, we are the oldest family response organization as well. We're a grassroots organization that started in 1992. We're located on the coast. We basically started around a kitchen table of neighbors who were concerned about the fact that there were children who had needs that were not being served and not being seen. Since that time, 28 years ago, we have taken on several challenges. Children, of course, live in families and children live in communities. And for the last several years, our communities have been dealing with the impact of wildfires. The first time that had a direct impact on the coast was in 2015 when the fires started in Lower Lake, and people from Lake County start coming to the coast to get clear air and cleaner air. And they came by the hundreds. And every year since then, we have had fires and we have had people coming to the west side of the county who have health challenges, asthma, heart conditions, being treated for cancer, pregnant young infants who have had a great need to get to where there is clean air. So while we've been fortunate not to have a fire directly in our own community for several years, we definitely see ourselves as your neighbors. And we see ourselves as a resource for people that are dealing with particularly difficult challenges. We have for several years created a pop-up free thrift store. And as people have come into the community, they've been directed to us. And as much as possible, we have tried to connect them with motel rooms, with food cards, with gift cards for gas, with clothing, with sleeping bags, connect them with possibilities for places where they could tent camp, connected them with social services, with churches. We network very, very closely with about 40 or 50 organizations on the coast. And that network has been built up because we know that when there's a crisis, you have to be ready to move. You can't wait for your county or state or federal government to give you direction. The more inches you are away from the center of power, the larger your geographical area and the smaller your population, the less likely that you're going to get a response outside of the community to serve you. Not because FEMA doesn't care or the Red Cross doesn't care or Sacramento doesn't care or Washington doesn't care, but just the logistics of number of people to be served based on the square mileage that we cover makes us all very vulnerable. We are dealing now with some unprecedented challenges. It started with COVID in early March. And we recognized in early March as we met across the county with many organizations within the county through an organization called BOAD, which is Volunteer Organizations for Disaster Assistance, that we really needed to scale up very, very quickly. And so if you're listening from Laytonville, or you're listening from Gualala, or you're listening from Hopland, or you're listening from Covelo, the things I'm sharing with you are universally true, regardless of where you are in the county. The most important thing that you can do as a community is to create a strong community network. A network of us, not us versus them, but a network that is a circle that includes everybody. Your schools, your local county representatives for social services, your fire departments, your service clubs, your churches, your hobby groups, whether it's people that are bicyclists or people that are quilters, the Grange, Any organization that already exists in your community is a possible resource for strengthening your community when you're facing challenges. We have been working in our community, which is basically the coastal area of the 4th and 5th district from Westport down to Gualala and inland to Comshe, to make sure that resources are on hand ahead of time, so that when people are coming here for relief from health conditions, whether it's from San Francisco, or whether it's from the Bay Area, or whether it's from Lake County, or whether it's from Potter Valley, or whether it's from Shasta, that we can be good neighbors. We obviously can't solve everybody's problems, but knowing where the resources are, knowing what a realistic solution is, really takes the stress off of people that are already incredibly stressed by the potential loss of their home. And because of the fact that we have COVID, we have to come up with strategies that are different than the strategies of congregate housing, where you would create a rescue resource at a school or at a senior center. You know, we're very, very concerned about COVID transmission. People are concerned about COVID transmission. So one of the things that we have done in our community is to bring in a lot of sleeping bags. At least that way people can be protected to some degree from the elements of the weather and have something a little softer to sleep on. We're in the process of acquiring tents. The tents that we've had have mostly been distributed at this point, but we're reaching out and trying to accumulate more tents. If you have a community that does a lot of camping, you might ask them to self-identify with you if they have a tent that they can spare or share because their house has been spared, and they realize that there's someone in the next neighborhood or down the street that might need that resource. In other words, categorizing and cataloging your resources ahead of time really is a very valuable thing to do. We have been working with our service clubs and working with our school districts and working with public health and our agencies for many, many years. And because of that, we have a high level of trust developed between ourselves and our partners. And so we're able to reach out at a moment's notice and say, I have a family that needs housing. I have a child that has a health issue. I need someone COVID tested really quickly. Having that kind of framework and relationship set up on a 365-day basis when you're in a rural network, in a rural community, really helps you when all of a sudden there's an urgency or there is a sudden shift in the winds that is bringing smoke into your community, a certain level of urgency because COVID is raising in your community. And many of us are dealing with the fact that we know that our schools are closed. And so we have children at high risk because their parents have to go to work and kids have to be home by themselves. Setting up phone networks where you can ask a neighbor to check on your child is a very helpful thing to do. You don't want it to be a stranger. You want it to be a trusted family member, you know, a grandparent, even if they're out of the area, an aunt, even if they're out of the area, a neighbor who you have known since that child has been little that is reliable. And you want that child to also have that phone number and that ability to reach out, so that if something happens with your phone connection, if something happens with cellular, very often cellular will work outside of the area when it's not working inside the area. So we have gone through things where we have had events. I can remember with 9/11, where in my family's case, my family was in New York. My nieces and nephews were able to reach me in California, but they could not reach their mother, who was 10 miles away. And we're going to see that kind of disruption again. And so it's good to have a plan B when you live in a rural community, for not only phone numbers that you can reach to let people know that your child needs to be talking to someone or that you are safe, not just locally, but also more regionally and outside of the area. On our webpage, which you can Google Mendocino Coast Children's Fund, you will find a list of hundreds of resources for distance learning, for working with your children, for emergency numbers for health, for nutritional services, for mental health services, and we're constantly updating that list. We suggest that you look at that list and you think about within your own community creating a similar resource. It might be through your family resource networks. It might be through your school districts. It might be through a church group. But the more information that you can share, it might be your Facebook group up in Covelo, which is a very active group. It might be through one of your other affiliations. But what you want to do is cross-pollinate your community with information. You want to share it as widely as possible. Facebook is a wonderful resource for people who use Facebook. There are several good Facebook groups up now for, Danila has a wonderful, amazing site up. There's a couple of other news sites that have come up recently. I think Mendo Fever is one, Mendo Voice is another. It's really, really important that you stay in touch with what is happening right now rather than waiting for it to show up in a newspaper, because very often having that information at your fingertips right now is going to help you make a life-changing decision to vacate your home or to leave an area or plan a path to safety that you can't do if you aren't current. There are many resources available for you on the county site. There is COVID information, and there is also NICSI alerts that you can sign up for, and it's important that you do this. The NICSI program you can reach through the Mendocino County Sheriff's Department. I think that Matt was just on recently talking about resources. I'm just trying to re-emphasize that because you may not have heard that presentation just before I was on. And it's important that you hear this. And sometimes we have to hear things 2 or 3 or 4 times before they sink in. The other thing that I want to talk to you about, which is critically important, is no one is going to come rescue you. You have to be planning for yourself what you and your family are going to do. Our small, courageous, committed volunteer fire departments can no way on their own reach you in time if there is a fire. You have to be ready to go. The sheriff's department will do the best they can to alert you, but we are a huge county and we are very, very understaffed. And many of you live up roads that take a very, very long time to reach. It's not like being in a suburban area or an urban area. It's not like being in Santa Rosa, where my family was just evacuated from. It's not like being in some of the areas in Napa that are a little bit more closely related to each other in terms of access. So you have to be planning, and that means having a go bag ready. And a go bag is simply the most essential things that you need: your medications, your eyeglasses, an extra pair of shoes, a warm sweater, water and food for yourself and your family, a charger for your phone, a flashlight. You can go on just about any site and just Google in go bag, and you can find a huge amount of information. Danila and I will make sure that information is posted on Facebook for you with some very small and accurate lists of how to do this and do it quickly. We have unprecedented heat right now, and we have 2 more months of fire season. And you have to be planning as if there will be a fire, not maybe, but when. And the worst thing that will happen is that at the end of the 2 or 3 month season, you'll have some food that you need to put back on your shelf that you didn't eat. You'll have some medication to put back in your medicine cabinet that you didn't use. It's important that you contact your health providers and get extra medication. Do not be counting on the fact that if you're down to a 3-day supply, you're going to be able to get a refill to get you through the first week or 10 days of a fire if we have a fire in Mendocino County. We have pharmacists and nurse practitioners and health people on our Children's Fund board, and they advise us. I've received a notification from my own health provider. I'm a Medicare age, telling me to refill my prescriptions now. I don't think that there will be any problem with you getting refills. You should have at least a 2-week supply on hand, particularly if you have a pre-existing health condition. The importance here is that you have to take responsibility in a very proactive way for the outcomes that you are going to be facing over the next 2 to 3 months. We want you to do everything that you can to keep your immune system up. The healthier you are, the better chance you have of surviving COVID if you have an exposure, of surviving the seasonal flu season that is opening up right now if you have an exposure. If you're someone who believes in vaccination, and I'm not trying to have that debate here, please get yourself vaccinated. If you're somebody who does not believe that that is a safe route for you, please take whatever precautions you need to take to protect yourself from possible contamination from other people. Masks are incredibly important. The county has just brought in thousands of masks that are the equivalent of N95 masks. I believe they are going to be distributed over the next week through public health and through the clinics. If you are somebody who is at all sensitive to smoke, you should be reaching out to public health and reaching out to the clinics in your community to get a mask now. These masks are not certified for medical use within a medical facility, but they meet all the other requirements of an N95. And right now, the biggest risk to you, to be quite honest, is smoke. Smoke can do lifelong damage to your lungs. It can do lifelong damage to people in all kinds of ways. And so anything that you can do to protect yourself from smoke exposure is really important. And I will be posting things on the Children's Fund Facebook page and also sharing them with Daniela about what you can do to protect yourself from smoke. The other thing that is a really effective solution to smoke mitigation is to buy a box fan, a 20-inch box fan, a 20-inch furnace filter that is rated at 11 or higher, and very simply attach that filter to the back of the fan, either with duct tape or with a bungee cord. Put it in a closed room where you and your children sleep, and make sure you're pulling all the smoke out of that room. A lot of our housing is inadequate. A lot of us have housing that has a lot of transmission of smoke that comes in through single pane windows or windows that are not well caulked or houses that are not well insulated. You can't change your housing at this point, but you can do everything you can to try and protect yourself from smoke coming into your home. So those are the kind of tips that I'm offering to you out of our 28 years of working in these situations. I also want to tell you that there is absolutely no reason for any of you to ever feel ashamed for asking for help. You help the whole community when you help yourself. The healthier you can keep you and your children, the healthier the entire community can stay, and the sooner we can get through the things that we're facing. There's a list of resources on the Mendocino Coast Children's Fund page. There's a link right to Healthy Mendocino. You can also go to North Coast Opportunities. You can go to Danila's amazing page. I think it's Mendocino Action News. She will be able to tell you and chime in with that. I don't have that name memorized, I'm sorry. If you use Facebook, just please try and get yourself enrolled in the Facebook pages that are sharing responsible information. Try and do everything you can to focus on your own well-being right now. It will help everybody.